Welcome everyone to our Rouser College pre-health info session. I'm Jay Sevilla. I am the advisor for the nutritional science majors. And here we have Irma Moreno, a pre-health advisor from Career Engagement. So I'll go ahead and let her introduce herself.
Hi, my name is Irma Moreno, as Jay said. I work with the Berkeley Career Engagement, formerly known as the Career Center. I've been a pre-health advisor for about 15 years. I've worked at UCSF in their medical education department. I've also worked in admissions at the Berkeley UCSF Joint Medical Program in UCSF. So now I do this, and I will go over a lot of pre-health careers besides medicine, because I know a lot of you may not be interested in medicine. So do I start or?
Thank you, Irma. I'll go ahead and give a quick agenda for today, and then I'll
Okay.
let you go ahead and get started. Um, we'll have Irma go through a presentation with you all, and then I have a resource that I will share with you that goes over here are all of the Rouser majors that can help satisfy most pre-health prerequisites across the board. And then we'll have some time for Q&A. And any questions you have, please feel free to use that Q&A function or the chat and just send it to me. I'll be fielding questions, kind of like doing hosting things, but all of our pre-health knowledge will be coming from Irma. So I'll go ahead and leave it to you.
Thank you. So I'm going to try to let's see, trying to share my screen. Here we go. Let me know when you can see the screen.
Yes.
Okay. So again, we're doing this pre-health overview for students. I see in the chat that many of you are interested in medicine, and there will definitely be some of that. But, again, I know that some of you are not interested in medicine, or maybe along the way you discovered that there are other areas of interest for you, since many of you are freshmen probably. Just to let you know, I'll give you the information later. But anyway, this is our agenda. So the pre-health careers, the various careers, general information, med school, veterinary school. I know there are a lot of Rouser students interested in vet med, and all these other components that go into a lot of the different applications, pre-health applications. So pre-health careers, and these include medicine, dentistry, pharmacy, physical therapy, optometry, nursing. I mean, you can see the range. I think the majority of our students are interested in medicine, dentistry, pharmacy, and PA and nursing. Also vet med, as we talked about, especially within the Rouser College. So here's the recommendation for all pre-health careers that we talked about and some that we may not have talked about, and that is that your grades are very important and a strong GPA is encouraged. Although a 4.0 is not necessary, and that includes medicine. Most of our students don't have a 4.0 that go to medical school. But a strong GPA is again encouraged, and you might have a 3.6, a 3.7. You would still be viable for medical school. And the thing about medical school, and for most of these programs, not just medical school, but veterinary or PA, is there's no formula. I can't say, well, if you have a 3.7 and an MCAT of 510, you're going to get into this school, because we just never know. So remember that you are not alone in this journey. You've got your Rouser advisors, you've got us, you've got the Student Learning Center. There are other programs. If you are an EOP student, you have advisors there. So it's just really tapping in and seeing, what makes you comfortable, who you're comfortable speaking with, and asking those questions. And, we will try to clarify as much as possible. Being flexible is super important, because sometimes things don't, go as planned. So, I mean, the big one, of course, is COVID. We had COVID. There were things, everything had to be pass, not pass. There were some things that students were encountering with remote learning, but also I know in the last maybe 2 years, it's been difficult for some of our students to get certain courses like chemistry. Maybe you get the Chem 3A, but you don't get the lab and you have to postpone the lab for another semester. And that's perfectly fine. It doesn't have to happen concurrently, but just be flexible with your 4-year plan, as many of you have. For any of these programs in pre-health, whether it's medicine, dentistry, pharmacy, the major that you have is not really that important. What's important is that it is important to you. Being a Rouser student is different than being an LNS or a chemistry student. And again, what's important to you is what matters, as long as you fulfill all the requirements for a particular school. So, most of my students going to med school, they come from English, sociology, public health, Rouser, MCB, IB. So they come from a little bit of everywhere. It's not just all MCB, all Rouser, or all public health. It just runs the gamut. The general info, again, for most programs, you don't want to do pass, no pass courses for the requirements. So for nursing, microbiology is a requirement, but not for medical school. So again, if you are thinking of nursing, you don't want to take a pass, no pass. You want to make sure that you take it for a grade. And one caveat I have to give is that schools may change their requirements between today and the day you decide to apply. That happens all the time. I get emails from folks that have graduated in 2021 or 2022, maybe even in 2009, saying, I took this set of courses and now I see that this is a requirement. So they have to go back and finish some of those requirements elsewhere. Again, the amount of units you take in a semester is really up to you and what you can manage. Manageable coursework is important. Time management is important for med school, for dental school, for any of these programs. And the amount of units you take shows how you manage your time with all the activities, extracurricular activities you have to usually have in order to pursue some of these graduate programs. Having a double major minor doesn't make you more competitive or less competitive. If you have just one major, that's great. If you have 3 majors, that's a problem, because it raises a red flag and it shows that you're not committed to one thing. So having a double major is okay. A minor and a major is fine. But again, it's not going to give you an edge in anything. Again, doing the things that you enjoy. If you have a major Rouser, but you're really interested in public policy as a minor, or global health, then pursue that because it's interesting to you, not because you think it's going to make you a better applicant. For certain health profession programs, you need to take coursework elsewhere. So for veterinary medicine, animal nutrition, not offered at Berkeley. For PA, there's a medical terminology course not offered at Berkeley, and developmental psych for a lot of other programs like nursing and PA and whatnot. Those are not offered at Berkeley. So you would have to take them either at a community college or a place like UC Berkeley Extension. AP courses. Schools vary on their acceptance of AP and IB courses for medicine, but also for other programs. So for medical school, as I stated here, AP and IB courses are acceptable at UCSF, but Irvine will not accept them, especially for the sciences. This recently changed for UCSF because 2 or 3 years ago, they were not accepting AP courses, and now they do. Again, things change. So again, they change required courses frequently. Example, UCLA Medical School has absolutely no requirements, only recommended courses. But when you apply to medical school, you apply to about 20 to 30 medical schools. So you want to be able to cast a wide net when you do apply. And some of medical schools on the East Coast, particularly in New York, will not accept AP for English, is another example of this. Icahn, Cornell, Columbia, Einstein, those, and I think Tufts and Harvard, they do not accept AP for English, and they want 1 year of English from their students. So again, that is now, maybe 2 years from now, things have changed. Community college courses. So most health profession programs, including medical school, will accept courses taken at community college. If you're a Berkeley student that's been here for 4 years, your science requirements should be taken at Berkeley. Taking the following at community college is okay, like stats, psych, math, English, those are fine. If you are a transfer student, the science courses you took at community college do not have to be retaken at Cal. They can and will be used when you apply to your graduate program. And then again, like I said before, some may have to be taken at community college because they are not, they're not offered at Cal. Transfer students, all coursework taken at community college will be calculated into your overall GPA, your science GPA, your activities, your work, your research, your leadership skills you gained at your community college or at a state school or at another university will be taken into consideration and added into your application. So there's no need to retake prerequisite courses here at Berkeley. And when you transferred here, you probably saw some of your courses transfer over. And even if they didn't transfer over to Berkeley, they will go into your medical school or other graduate school application. So these are the med school required courses, since I know a lot of you on the call are interested in medical school. 1 year of biology with lab, and that includes 1A and 1B. 1B is always, everyone's like, well, you don't have to take a whole year of biology, and 1B is really not biology, but it is. Here's the thing. Some schools will accept an alternative course in biology, upper division, something like that, in substitution of 1B, but many schools will not. So in order, again, to cast a wide net, it is always better to do 1A and 1B just to be safe. Physics, there's 7A and B or 8A and B, 7A and B. I know if you're a chemistry student or majoring in physics, it would be 7A or B. Given that you're a Rouser student, probably 8A and B are the better course for you. We have a chemistry sequence that is just for med school, not for the other programs like veterinary, nursing, or PA. The chemistry for medical school is taking general chemistry, 1 semester of general chemistry, 2 semesters of organic chemistry, and 1 semester of biochemistry. If you've never taken a chemistry course, whether AP, honors, or just plain chemistry at high school, then start with Chem 32, which is pass not pass, to give you an introduction to that. Then there's also one requirement of an upper division biology course of your choice. And that's usually something taken in the IB department or MCB, and looking at allied courses that might satisfy something for your major that can be taken at a different college. That might be something you have to go with. There is a school in California that requires that, and that is Irvine. That's why we really think of it as a requirement, because of most of our students will apply to California schools. Majors like engineering, chemistry, again, those have different requirements, or you can fulfill the requirements with other coursework that is not available to just, other colleges. Recommendations, again, 1 year of English, because you want to apply to certain schools, a semester of stats and 1 of calculus, and then psych, social, anthro. And those courses are really recommendations. Most schools don't require them, but they are on the MCAT, for example. I think there's a portion of the DAT that also includes that, the dental exam. One thing about the courses here, some of these can be taken at community college. So that's nice. If you've taken any of these in high school at a community college, though you've satisfied the requirements, you would not have to retake them at UC Berkeley. So veterinary medicine, here are some of the course requirements. These are listed in our website as well, Gen Chem. Now there, for all other pre-health professions besides medicine, you will have to take one year of general chemistry with lab, 1 year of biology with lab, bio 1A, 1B, again, organic chemistry, there's physiology, and they prefer IB 148. And I think that one's only offered in the fall, but I could be wrong. microbiology, biochemistry, physics, genetics, math, animal nutrition, and public speaking. Those 2 courses are not offered at Berkeley, so taking them at community college. Psychology 1 semester and 2 semesters of English. So that's important to keep in mind. These are some of the nursing requirements. Again, 1 year of general chemistry, biology, microbiome, anatomy, physiology, English, nutrition. Now they do require nutrition, and the lifespan human development, psych, and oral communication that again are not offered at Berkeley. So making sure that you take them at a community college or, and they are mostly offered at community college. And again, nursing is a very, there are so many different types of nursing degrees and nursing programs that it really requires you to meet with an advisor to figure some of that out. A lot of it, you're going to have to do the legwork because it's very school specific. So some schools may require most of these courses, but then have additional courses like USC does require Spanish. So being very careful before you apply, before you think of attending a school, really going through their requirements and their website. So again, exams, MCAT for med school, the DAT for dental school, the GRE for veterinary schools. Some schools will accept the MCAT for veterinary medicine. There's some nursing programs do take the GRE or require it. Physical therapy and PA programs require GRE as well. PA programs can also may, instead of taking the GRE, they may accept another specific, more science-based exam that's very new. I want to say it's the PCAT. No, it's not the PCAT. It's PA-CAT. So schools will take GRE and PA-CAT. Again, the PA-CAT is a very new exam, probably in existence the last 2 years. So schools are accepting both the GRE and the PA-CAT. So extracurricular activities. So most of these programs do require or want you to explore their program and demonstrate to them that you are indeed interested in the profession because of the experiences that you've had. So not required, research is not required for medical school or for veterinary medicine, definitely not for PA or nursing. Most of those professions do not do research, but veterinary medicine, dental, and pharmacy would, you can do research if you're interested in those programs, but they're not required. It is really what you're passionate about. And any type of research is valuable. So it could be psych research, public health research, public policy, wet lab, or any animal or insect type of research. I've had students even do research in astronomy because they were interested in it and they really enjoyed it. And they went on to medical school. So most students getting into medical and veterinary programs do so with no research. There are some very research institutions like Johns Hopkins for medical school or Washington University for medical school. Those schools do prefer you to have at least 2 years. Northwestern. There are a few. So again, talking to one of us at Berkeley Career Engagement is helpful in trying to determine where your interests lie. So shadowing for medical school is not required. However, if you are interested in really seeing what the profession is like because you're really on the fence and not sure, it's good to do some shadowing. But medical schools don't put a lot of stock into shadowing because technically you're not doing anything. You're just watching a doctor perform his or her duties. Dental, veterinary, and PT schools do require a certain amount of shadowing. So for dental, it can range from 25 hours to 100. For veterinary, it averages at about 50. For PT, it depends on the school. And for that, you do have to be a little bit more involved in actually shadowing. You're probably a PTA. So again, the amount of hours are school specific. Patient care experience. So for physician's assistant program, that requires more than shadowing. It requires actually being a medical assistant or an EMT for between 500 to 3,000 hours. And that could be 2 years doing the work full time. So definitely there's going to be a gap between graduation and applying to the program. And again, with patient care experience, it is very school specific. So Stanford, I think, has 500, but Western down in Southern California has about 2,500 to 3,000. So you have to decide and do a spreadsheet as to which school requires what and what schools you're interested in applying to. So when I said, for example, that for medical schools, students apply to 20 to 30 schools, that is not the case for physician's assistant. It's usually 5 to 7 schools. For dental and veterinary medicine, it may be 10 to 12 schools. So it depends on the type of profession that you're interested in, where you would be applying and how many schools you would be applying to. So clinical and leadership. So remember, not all your activities need to be health related. So if you're really passionate about nutrition and you're devoting some of the time to maybe working at the basic needs center or at the food pantry or doing research around nutritional work with depending on the type of population, it could be clinical research. All of that is really important, and it's something that you're interested in, then do it. They're not technically medical, but they are. They do inform how a person may, with diabetes may eat, or maybe you're instructing someone that has kidney disease on what are the best foods for them to have. So they are sort of related to medicine, but they're not. You don't have to work in a clinic necessarily. You could be doing all kinds of different activities, but again, doing something that you enjoy is important. And you want to stick to them for more than a year, at least a year, but if not more. Because that doesn't show commitment to a graduate program. It just shows that you're kind of testing the waters, and it really doesn't give you the ability to gain the experience in a long-term basis to see if this is something you would want. If you are in a club, say you're in a dance club or a glee club or working with ASUC, take on some leadership positions if possible, if your time permits. Again, time management is super important when you're thinking of extracurricular activities, knowing that you have to have a strong GPA, knowing that you have to have these extracurricular activities and being able to manage them. So if you can only do one activity this semester, maybe next semester you might add another one, or maybe you don't. Maybe you do some things during the summer. So again, shadowing is not clinical when you're talking about med school. I have a lot of students come in and say, well, I've got a clinical activity, I'm shadowing. That's not clinical, that's shadowing. Another thing here to remember is it's not the amount of hours for medical school. You know, what is important is the activity, what you're gaining from it, what you're able to give back to that activity. It's if you only have 2 hours a month for 2 years, that's perfectly fine. It's not, again, about the activity. It's about the commitment to that activity. So we do not have a database of clinical experience, but, you know, there are clubs, decals, local hospitals and clinics. Even through URAP, you can apply to some of these clinics and some of these different experiences. We do know of some locally. They do fill up pretty quickly. So the best time to gain some of those, fill out some of those applications is towards the end of maybe spring semester and into the summer, because by the time fall rolls around, everybody's trying to do that. So getting those experiences is important, and there are definite ways to do it. And we try to give you as much information as we can. So gap years, I think this is a big question for students, is gap years, and, you know, take what happens during these gap years. But, you know, most of our students will take a year or two off between graduating and going on to medical school or veterinary programs. Dental programs, our students tend to go straight through as much as possible, but there are a lot who take gap years. So recently, about 2 weeks ago, it used to be that the average age of a first-year medical student was 25 years old. It is now 28. So clearly, students are taking a little bit more time to gain more experiences, to travel, to do the things that they want to do in their 20s before really, you know, buckling down and going forward. PA or P2 programs may require a little bit more time because they require more experience in the field before submitting an application. Even if you have had some of these experiences and you want to apply, sometimes you have to complete the required experience for a PA program before you even submit the application. And it's hard to do everything in the 4 years. I mean, trying to navigate Berkeley, the classwork that, the rigor of the classes that we offer, and trying to maintain your grades is really difficult sometimes. And it's best to really take your time and learn to manage that time. Again, time management is super important. So these are some of the resources. So Office of Undergraduate Research is a good resource to have because, like I said, if you want to do research on campus, they're the best resource out there. They do run the URAP program. I know Rouser has some other research available. The Office of Undergraduate Research also manages some of the clinical experiences out there, like at Alta Bates or at UCSF. Student Learning Center, great resource to have if you're, feeling a little bit lost in class or need some help. They're great. Your academic and peer advisors are great resources as well. They've gone before you. The peer advisors are great. They're maybe upper class persons, and they can give you some resources that they may have found helpful. You have us at the Career Engagement Center, the Berkeley Oasis Center. They run Calapalooza, and they run most of the clubs on campus. I think they were called the Lead Center before. I can't remember, but if you have the opportunity to, in the beginning of the semesters when they have all the tabling of the different clubs, you'd be surprised how many clubs there are that cover the array of clubs that are out there that are focused on pre-health. So before we go to questions, I did want to just put a plug in for career engagement. We have peers that are available to help you with your resume, your LinkedIn profile, and your cover letters. They're on a drop-in basis Monday through Thursday from 12 to 3 at our center at 2440 Bancroft. We're right across from Eshelman. On Fridays, they are remote, and there's a way on our website to find how to connect with them remotely between 12 and 3. We have various workshops in our center. Upcoming, we have a couple workshops. One my colleague Emily is doing on finding clinical experiences and experiences here at Berkeley. We have some med school visits coming up. At the end of October, we have the Washington University in St. Louis. And then on the following Monday, the 4th, Michigan State. So medical schools do reach out to us about hosting them because there is the UC Davis Pre-Health Conference on the 2nd of November. That's when we get most requests because people are traveling to Northern California and they just want to hit Berkeley and they want to hit Davis at the same time. If you are, I'd say, a junior or senior thinking of any of these health careers, I would encourage you to register for the conference. It's $35. It's at Davis, so there is a train. Amtrak train goes up there. It's an hour away. It has tabling from all the pre-health professions, and then in the afternoon, they have various sessions on admissions. They have current students in their programs. They have different types of, like for nursing, they'll have a nurse practitioner workshop, and then they'll have like an accelerated nursing program workshop. So you have a huge array of pre-health professions, and it's a great way to gain information. So now questions for myself or?
And sorry, before we go into questions, I did want to share this resource for Rouser College students. Here are like different majors. I can share my screen as well. I'll put it into the chat right now. Like here are all the different majors here at Rouser College that can help satisfy a lot of the prerequisites for different pre-health pathways. So let me just get to that screen. So you'll see the majors on the left-hand side. So majors that can satisfy a lot of, or can help you satisfy a lot of pre-health prerequisites would be nutrition and metabolic biology, formerly known as physiology and metabolism, genetics and plant biology, microbial biology, molecular environmental biology, environmental science, and conservation and resource studies. You can see um, based off of that major, here are the major requirements that they have that would already satisfy a lot of pre-health prerequisites. And then on the other column, what are prerequisites for pre-health, not necessarily included by the major requirements in their curriculum as it is. So these are things that typically you would have to add on top of your major requirements. You can also see a list of the prerequisites based off of the career pathway. So we have all the different types of pathways listed here. Career engagement and pre-health advising links as well. And then, just connecting with your Rouser College advisors for any major related questions as it relates to pre-health things. So a lot of times what we try to share with students is, most of us biology majors here in Rouser College have a pretty general understanding of pre-health related things. But a better way to maybe frame how, pre-health advising, IRMA works versus, your Rouser College major advisor would be like all the specific niche questions about applying to pre-health programs. Basically, all the stuff you learned in this presentation would be, you'll be getting a better answer from pre-health advisors. But you can always reach out to us and we'll let you know what we do know. But what our roles as your major advisors are is how can we fit your prerequisites into your time here at UC Berkeley based off of your major requirements, things you've already satisfied. Maybe you took at a community college already or AP credit like Irma was going through. So those are kind of the different ways to distinguish like pre-health advising services versus your major advisor. So this resource is in the chat for you all. I know we have it somewhere on our webpage and I don't know exactly where it is. So maybe when I send out the recording, potentially this presentation as well, I'll also share the links for this resource and any other places on our Rouser advising webpage where you can find pre-health related things. So with that, I'll stop sharing my screen and then allow, the next 18 minutes for questions that anyone has, whether you want to put it into the Q&A, put it into the chat, or if you just want to raise your hand and come off of mute.
Also, before we go on, I just wanted to share that we have an Instagram account at Cal Pre-Health. And it was last spring that we showcased students that were moving on, alum that were moving on to medical school, dental school, pharmacy school. And I would say 3 students going on to med school were all Rouser. Environmental science, nutritional science, conservation and resource studies. And yeah, so it's pretty exciting. And, we had quite a few students from Rouser and I put out an ask if they would be willing to share that they got into medical school or dental school. I don't think our dental school applicant was that we highlighted, but yeah, I was really pleasantly surprised. There were a lot of your students. Another thing too is you can always sign up for our health and medicine newsletter through Handshake. If you have difficulty figuring that out, we can definitely help you. And another thing is that one of us is housed at Rouser, at Mulford on Mondays from 2 to 4. So you are welcome to drop in and ask a quick question of us.
Hey, yes, Allison.
So I have a question that other people might also have, because I've been getting this a lot, but and I've heard some sort of conflicting views on this, but generally what I'm hearing is that Irma, as you were saying, like you should be taking basically all STEM classes at Berkeley if you're coming in, as a first as a freshman, as a first year. But then there's obviously the occasional person who really wants to take, physics, for example, outside of Berkeley. Is that just absolutely a no-go, or is there some wiggle room here where the odd STEM class might be taken elsewhere?
I'd say if there's going to be any STEM class that can be taken at a community college, it is physics, not chemistry, because we do have a unique chemistry series, and chemistry is, a lot of we've had this series since 1990. Medical schools are aware of it, but sometimes personnel change, and so I can write a letter on a student's behalf, provided they took all the coursework at Berkeley, and I could vouch for the rigor of the course and what's covered in the courses. If a class like, say, Chem 1A or one semester of chemistry, either organic or general, is taking elsewhere, I can't do that for them. So they would have to take the follow-up, which is the second part of general chemistry elsewhere or on campus. Physics is a course that a lot of students can't always fit into their major requirements, taking major requirements in pre-med, excuse me. However, if it's a financial issue, there's a way to explain that sometimes. Sometimes our students cannot take physics, for example, during the summer because it's financially constraining to them or their family. There's a way to talk about that in the application if need be.
Okay, thank you so much. And then just a follow-up to that, same thing with English. Students are, testing out of that. Is that just like based on the medical school, whether they want, because I've also heard, no, you may have tested out R1A, take it again at Berkeley.
Yeah,
is that
most schools do not require English, but some do. And there are a great group of schools in the East Coast that will not accept AP English for the requirement of 1 year of English, or at least 10 units or 9 units, something like that. So that's why we recommend students take it. And a lot of our students do want to apply to schools like Cornell or Einstein because they have the free tuition now. Harvard, Tufts, most of those schools will not accept an AP in English.
Okay, thank you so much.
Awesome. We have about 13 minutes left in it. If anyone else has any questions they want to bring up. Yes, Rami?
Yeah, sorry, I joined late, so maybe I'm sure this was, talked about earlier, and I can go back on the recordings. But yeah, just going on the same kind of thread about AP credits, I've also heard quite a bit of like contradiction in that sense. I'm a freshman, and specifically with like Chem 1A, which I'm not taking this semester because I have AP credit. A lot of people are saying that med schools, like most med schools, don't take any kind of AP credit for that. But when I did research on their websites, a lot of them said that they do, as long as you use that credit to pursue like OChem or upper div chem courses. So I'm just wondering, in your guys' experience, how many med schools would take AP credit for those intro level classes like Chem 1A, Bio, and B, and if that's a good idea or not.
So currently, I would have to take a look at some of the schools. Now, you can't always go by what they say on their website. We have a publication that we use to go over requirements and what medical schools do accept. I would say with the sciences, the chemistry, biology, and physics, that you take them again at Cal just to be safe. So this is an example. Stanford claims they don't have any requirements, and they really don't. But I've known students that want to apply there and then get told they need to take chemistry 1A. They cannot AP out of it. So this happened a couple of years ago to a student who hadn't taken Chem 1A and was trying to use their AP credit, and Stanford said no. You can argue that with the school at that point in time. You can show your MCAT score to them, etc. It's really up to the school. So in order to be safe and apply broadly, you want to take Chem 1A at Cal.
Okay, thank you.
Something I want to add to that as well, thinking about testing out of something that would be a prerequisite for other courses or other series in your time here at Berkeley, which would likely be a major requirement. Something to think about is also just being prepared for the rest of the series, whether that's waiving it out through AP score or high school exam equivalency scores, or even community college courses, because oftentimes, for example, with community college courses, I've heard students say, I took Chem 1A at a community college, and then I'm taking Chem 3A here, and there's a gap in content or preparation. And so that's just something we can't necessarily guarantee, is if you are not taking the prerequisite of a series here at UC Berkeley, but then continuing the rest of the series here at UC Berkeley, that you're going to be fully prepared for the rest of the series here. And so that's just something to keep in mind, whether it is major requirements or pre-health prerequisites, is whenever you're taking a series of something, if you don't take the entire series here, are you going to be fully prepared for continuing the series? So that was just something I wanted to add to that.
And I think along those lines too, when you think of taking, so say you took it at a community college and it was a quarter-based community college, and now your semester, that's a huge difference. So if you're going to take something like English, one semester of English at a community college, make sure it is a semester-based community college and not quarter-based, because even though if it's in the summer and accelerated, it's still a quarter semester or a quarter for them. It's based on that system. So you want to make sure that it is a semester system.
Yes, Greg.
So I'm a junior. What do you guys think is the best thing I can do to get clinical experience in terms of jobs or internships or anything like that?
I think starting with clubs on campus, there are decals on campus. I know that there's the suitcase clinic, for example. Really, I think meeting with someone, because sometimes students will say, I don't have any clinical experience, but I've been working as a translator for bio, or I have been doing intake at a community clinic or something like that. When we talk clinical experience for people in your, in undergraduate coursework, we're not saying you need to really work in a clinic or in a hospital, but you do have to have that interaction with patients to see if that's something that you really want. So there are some clubs, there are some places locally, like there's the Alzheimer's Center on Channing, there's Children's Hospital Oakland, Alta Bates, again, through UREP, you would have to apply for Alta Bates. There's the Patient Support Corps out of UCSF, again, through UREP. And then there's Zuckerberg General. They take people to help out, and you're basically providing resources for patients or looking up transportation for patients, things like that. So there are a lot of ways to do that. If you want to do it during the summer, that's also a possibility. There are some internships that you can access or some type of programs that may exist to help you get there.
Okay. Is EMT school something that Berkeley offers, or they have a partnership with the school that does it nearby or anything like that? Or
no,
okay.
No. If you do get an EMT certificate, there are a couple clubs like BMRC and Rock Med. So BMRC is Berkeley Medical Reserve Corps, and they take students with those qualifications. Being an EMT while you are a student is very difficult to manage, because they do require 12-hour shifts. So it becomes really hard on you. But that's why these two clubs exist, because you are doing some type of medical support. Your Rock Med, you're going to marathons, rock concerts, events where they have those first aid tents and working alongside physicians to treat people that come in.
Okay, cool. Thank you.
Mm-hmm.
All right, we have about 6 minutes left. There two people shared questions in the chat. Um, so first question is, can one be a prerequisite for med school? And then a question about taking reading composition for the 1 year of English.
Yeah, R and C, A and B are okay for the 1 year of English. Anything in the college writing program, R and C courses, college writing, comparative literature, rhetoric, those are all great. Chem 1B is not required for medical school. Again, if you take the whole series here, 1A, 3A, 3B, and MCB 102, we can ascertain to a medical school or that you have taken all those courses here and they understand the rigor of our program here. So they are aware of it. Taking any of that series outside of Berkeley, then you will be required to take Chem 1B. But if you take it all at Berkeley, then it's fine. Medical schools do not care where you went to undergrad. And there is no grade inflation, deflation, as there is a myth out there that there is. And that's why, you know, our courses are more rigorous and someone else's. A B here is the same as a B at a state college as it is at Stanford. So, you know, it doesn't really matter where you went to undergrad.
Okay, and this will probably be the last question that we take, but if you have any other questions, I'll put the web page for pre-health advising into the Zoom chat. Question, do medical schools care which university you went to for undergrad?
Yeah, I just answered that. So no, they don't.
All right, well then, if there are final questions or thoughts for last 4 minutes. Yes, go ahead.
Sorry, yeah, just quickly, I was wondering if you guys have any advice about what order to take, like whether to take OChem first or like for example Bio 1A if I'm a freshman, or if it doesn't matter really.
I don't think it matters. Just don't take them together.
Yeah, I'll say, I mean, Bio 1A has a recommended prerequisite of Chem 3A. And speaking to my students, it's been a 50-50 of whether, like, if you were to combine anything, it's really a 50-50 of taking Chem 3A plus Bio 1A or taking Chem 3B plus Bio 1A. It depends on the instructor. It depends on, you know, your own skills and abilities with OChem. So there's no like set recommendation just because it really varies case by case basis.
Okay, thank you.
Mhm. One final question or thought from anybody? All right then. Well, thank you so much, Irma, for visiting us and
Thank
sharing
you.
all of your information. Do you mind sending me your presentation and I can share that out with students with this recording?
Sure. I'll share it with you this afternoon.
Awesome. And then if anyone here is looking for that recording, it will take some time because we do have to transcribe it first. But that will come out to you as soon as it is done being transcribed. But thank you everyone for visiting, and I hope you have a great rest of your day.